Have you been wondering how contamination OCD and ERP march together? That's what today's video is about. We're making sure that we do ERP more specific for contaminations. I'm Jaime. I'm an ERP, EMDR and CBT therapist, specialist in OCD, and I'm from the online therapy clinic. Today, we are thinking about contamination, facing the germs, the dirt, and the illness with ERP. Contamination OCD often sounds loud and urgent. Wash now, clean now, make it safe. The obsession is the fear of being contaminated or contaminating your loved ones, your close ones, the one you care the most. Sometimes the compulsions are washing, sanitizing, cleaning, changing clothes, avoiding dirty places, and reassurance from others, and mental reassurance, like it's probably fine, or I didn't touch it long enough, or I touched something else, or I touched this, that is trumping this. So ERP asks you to do something brave and simple. Approach your field and don't perform the ritual, and stay long enough to learn that your body and mind can handle the uncertainty, can learn that they can cope, and can reclaim your life. So here are the core ideas. Exposure is about doing a small planned step that trigger your contamination fear. You can see a link to one of our videos that explains how we do that hierarchy first. And then the response is the prevention of doing it. Again, another video in the description where you can go and check how we set that up. So the response will be the washing. The exposure will be to the situation that triggers your intrusive thoughts. Then we add the opposite of what OCD tells us, right? So we lean more to the discomfort rather than we've been leaning toward the comfort. And once again, in one of those videos, we talk about setting yourself to succeed and staying without your window of tolerance, and also making it challenging and doable. So think anxiety like a wave. If you run, it chases you. If you stand and breathe, the wave crashes you. ERP is choosing to stand in an angle. So the wave breaks and it doesn't splash you front. We want you to do it in a way that is discomfortable and is not dangerous. So let's make it practical. Let's give some examples. Begin with a hierarchy. Now you can see how it's done. Then decide where you start, touching doors, sitting in bus seats, using public transports, and so on and so forth. Then you pick the one that is within your sense that you can do today, that you can achieve, not hyper-aroused, not hypo-aroused. Do the exposure and notice the urge. Notice what your body is telling you. Notice what your mind and your OCD is pushing you to do, that response. And we set an amount that we want to delay it. So you say, well, I'll be touching this pen and I'll touch it for a minute and then I'll leave it and then I'll be 30 minutes, 20 minutes, 10 minutes waiting. Then I'm going back again, hold the pen a bit longer and stay longer without washing, and so on and so forth. So we are not chasing the relief, which is in another video you can see our cycle. We're literally getting used to it. We are habituated. And over time, the waves start to feel less impactful. Adaptations can change, adaptations can help. So we're all different. And in therapy, we will do it specifically for you. So if your ritual is, your response is washing your hands 20 times or putting the pump 5 times, then wash, 5 times, then wash, and do that for 20 times, let's say, then we will be looking into either reducing the soap pumping to 1 and then do it 20 times, or reducing the amount of doing. So we do the 5 times of the pump and then we only wash once. That would be for you to figure out. That's what we would do in therapy. We'll figure out exactly where you start. Steps, small steps, big gains. So opposite. OCD tells you change your clothes immediately, you keep them on. And if it tells you wipe everything down, even when you haven't touched, then don't do it. Just stop it there, hold it, and it will pass. You can see the videos how you do that. Likewise, think, is it what I'm doing actually worse than the OCD? So having worked for many, many years as an ERP therapist, and a specialist in intrusive thoughts and intrusive urges and emotions. You can read again. We have another, I have a podcast on it. You can look at it and you can listen to it. These intrusions sometimes lead us to do behaviors that are worse. So in the case of contamination, you may be wanting to bleach everything out. You may be bleaching your hands, you may be bleaching your loved ones. That very same process sometimes is more harmful than the fear that you're having. So think when your OCD is telling you to do something, is there here a secondary risk? Am I putting myself at actually more risk than what it's doing? That just touching something, right? So stay inside the window of tolerance, set yourself to succeed, and repeat. And that's all. That's closing for today. Hopefully, you get back to your freedom. That is not sterile, it's messy, it's human, it's alive. And ERP teaches that your nervous system might be discomfort, might feel the discomfort, yet there is no danger. It might feel that the uncertainty is difficult, yes, it's not an emergency. So thank you for tuning in. Hopefully it helped. I'm Jaime. I'm an ERP, EMDR, CBT therapist, and I'm the director of the online therapy clinic. Thank you very much.